This is Mrs. Phillips, and she came in with the worst headache of her life, and she took 1,000 milligrams of acetaminophen with no relief, and she also reported blurry vision and denied any past medical history. So I'm going to do a quick QSIT on her. She has her wristband with her name and date of birth. And on her whiteboard, she has the correct names and everything is updated. She is on room air, so she doesn't have no nasal cannula or mask on. She does not have an NG tube. There are no abdominal tubes or chest tubes. She does not have a Foley catheter. And she has 2 bore IVs, one in her right antecubital and then one in her left antecubital. And I would check for there's no redness, swelling, or tenderness in either. And her bed is in the lowest position. She has 3 side rails up. She has her call light within reach of her. There are no obstacles around her bed, so she's able to get to the bathroom freely. She has some water, and she has a trash can down that way. So now I'm going to do a head-to-toe assessment on her. So I'm going to knock. Hi, Mrs. Phillips. My name is Grace. I'm going to be your nurse today, and I'm going to do a quick head-to-toe assessment on you. First, I'm going to wash my hands. Use some gloves. And I'm going to check her vital signs first. I'm going to check her temperature. Can you open your mouth for me? Thank you. Okay, it ended up being 103.28 degrees Fahrenheit, which is really high. And now I'm going to check her pulse bilaterally. It's present, about a +2. And her rate is regular, and it ended up being 92. And now I'm going to check her respiratory rate for a minute. And that ended up being 20. And now I'm going to do her blood pressure. I'm going to do the blood pressure on her right arm with her lying. And that ended up being 216/108, which is very hypertensive, and her pulse ox was 96% on room air. So now I'm going to check out her skin, and it's pink, warm, and dry. She has a little redness in her cheeks, and there is no abrasions or bruises anywhere on her skin. And she has elastic skin turgor, which was checked on her sternum. And are you having any pain, Mrs. Phillips? She complains of pain in her head. And can you rate it out of a scale of 0 to 10 for me? A 7? Okay. And when did it start? 3 hours? Okay. 3 hours ago? Okay. Does anything make it better or help relieve the pain? Okay, she says nothing helps the pain, so I would document that. And can you tell me your name and date of birth? And do you know where you're at? And can you tell me the date and time? She's alert and oriented ×3. All right, can you squeeze my fingers? Okay, can you push against me? And then pull back. She's able to do that. And I would check her pupils as well, since she was complaining of blurry vision. So can you look straight ahead for me? Her perla, she has perla. She has facial symmetry, and she is cooperative. And now I'm going to check out her lungs. I would check to see her chest was symmetrical. I would ask her to breathe in and out for me. Can you take a deep breath in and out? Chest is symmetrical, and I'm going to listen. I'm going to listen to your lung sounds, so can you take a deep breath in and out for me every time my stethoscope touches you? Okay, her lung sounds are clear. Are you having any cough? Okay. Denies cough. And she is not short of breath, and she has no oxygen on. So now I'm going to check your apical pulse, and I would check that for a full minute. And it is regular and strong, and it is, and S1 and S2 are present. So now I'm going to check. She doesn't have JVD sitting up, and then I would check her lying down. And there is no JVD present there either. And I'm going to check her cap refill and her fingertips. And it is less than 3 seconds. Are you having any numbness or tingling in your fingers? No? Okay. Can you wiggle your fingers for me? And there. Check for puffiness, no edema, and her skin is pink. Alright. Now I'm going to check out your stomach. Is there any pain there? No? Okay, I'm going to take a listen. Bowel sounds are present in all 4 quadrants. Her stomach is flat and soft. When was your last bowel movement? Today? Okay. Approximately what time? Alright, 9 a.m. And are you having any gas, or are you belching? Okay. Any constipation or diarrhea? No. And nausea and vomiting? Alright, are you having any urinary frequency, urgency, or pain or burning whenever you urinate? No. Okay. And any vaginal discharge? No. Alright. So now I'm going to check out her feet. Can you push against my hands? And can you pull back? Okay. There's no edema present. Check her cap refill. And it is less than 3 seconds in each toe. And are you having numbness or tingling in your feet? No. And can you wiggle your toes for me? And can you tell me which toe I'm touching? And her skin is pink, warm, and dry down here. And I already checked out her IV sites, and then I would leave her in bed with 3 side rails up, bed in lowest position. Your call light is in reach. And I would document the high blood pressure, because that is her major issue right now. So now I'm gonna report off to the next nurse. So Mrs. Phillips is a 43-year-old African-American female. She came into the ED complaining of the worst headache of her life and took 1,000 milligrams of acetaminophen and said it gave her no relief. And she also reported blurry vision and denied any past medical history. Her vital signs were a temperature of 103.28 degrees Fahrenheit. She had a pulse rate of 92, which was regular, and her respiratory rate was 20. Her blood pressure was 216/108 in her right arm lying, and her SpO2 was 96% on room air. The doctor ordered blood testing and a CT scan and a chest x-ray and diagnosed her with primary hypertension, presenting with a hypertensive crisis. Mrs. Phillips was then given 5 milligrams of metoprolol via IV push, and 2 milligrams of morphine for a 7 out of 10 pain in her head. Her blood pressure remained elevated at 204/102, and she was then given hydralazine 10 milligrams IV push, and her blood pressure went up even more to 218/110, and her heart rate increased up to 104 beats per minute. She was then transferred to the ICU to be started on a nicardipine infusion at 2.5 milligrams per hour to keep her blood pressure between systolic 180 to 200. Shortly after arriving to the ICU, she was no longer able to speak, and she had a right facial droop, and she could not lift her right arm. So she was then transferred to the OR right away for a large hematoma from around her brain, and she is now, and they said she presented with a hemorrhage stroke due to her hypertension, and she is now on PO metoprolol, amlodipine, and hydrochlorothiazide, and she is tolerating them well, and her blood pressure is now averaging 140 to 150 systolic, and she will be discharged tomorrow on those same meds. So teaching on those meds and proper diet and exercise to help control her hypertension.